Are you tired of struggling with high creatinine levels and worrying about the possibility of dialysis? Imagine if there was a simple, natural solution right in your kitchen cabinet. What if you could use something as common as baking soda to improve your kidney function and lower your creatinine levels? According to recent studies conducted by reputable medical organizations, such as the National Kidney Foundation, incorporating baking soda into your daily routine can have significant benefits for kidney health. The alkaline nature of baking soda helps balance pH levels in the body, reducing the workload on your kidneys and promoting overall kidney function. These findings have sparked curiosity and excitement among healthcare professionals and patients alike. By tuning into this video, you'll discover the exact methods and dosages for using baking soda to lower creatinine levels naturally. Say goodbye to the stress and uncertainty of managing kidney health, and hello to a simple, effective solution that you can start implementing today. Imagine the relief of knowing that you're taking proactive steps to support your kidneys and improve your quality of life. Don't miss out on this valuable information. Let's embark on this journey together toward better health and well-being. Let's dive into our first question. Can kidney damage be repaired? This question pops up quite often, and the answer, well, it's not exactly a simple yes or no. You see, whether kidney damage can be fixed or not depends on a variety of factors. It's not just about whether the damage can be repaired, but also about which part of the kidney is affected, what caused the damage in the first place, and whether that cause is still hanging around causing trouble. Today, though, we're aiming for straightforward answers to tough questions, so let's try to unravel this in the clearest way possible. To understand this, we need to peek a bit deeper into how the kidney operates. Picture the kidneys as these intricate networks of tiny blood vessels linked to filters. Each kidney packs a whopping 1 million of these filters, called nephrons. But hey, no need to fret. I promise this won't turn into a full-blown anatomy lecture. We'll cut to the chase. Now, these filters aren't just sitting there twiddling their thumbs, they're on a mission to filter the blood. But let's not oversimplify things. These filters, also known as nephrons, are the real MVPs here. They're responsible for deciding which chemicals stay and which get kicked out as waste. It's a pretty fancy process, happening millions of times every single day. Before blood heads back into circulation, it pays a visit to these nephrons. Even though there's a teeny-tiny barrier between the blood vessels and the nephrons, it's so thin that the blood vessels can deliver all the necessary goodies like oxygen and nutrients to keep those nephron cells happy. They can even snatch back the stuff that the filter kicked out but is too valuable to let go in the urine. So essentially, we're talking about a super sophisticated filtration system working on a microscopic level. Now, here's the kicker, those nephron cells are walking a tightrope. They're barely getting by with just enough oxygen and sugar to keep chugging along. If anything messes with their blood supply, even for a moment, they're in trouble. And keep in mind, these are the cells responsible for filtering all the junk we put into our bodies, think toxins, drugs, sugar. You name it. And yeah, all that stuff can do a number on them. When these cells get injured, they might swell up or even kick the bucket. If they survive, they'll go through a rough patch where they're not functioning at their best. A swollen cell might block off its tubule. Remember, each filter connects to one tubule. If that tubule gets blocked or dies, nothing's getting through that filter. And that, my friend, is kidney failure, when your blood isn't getting filtered like it should. Now, a couple of faulty filters here and there aren't a big deal. But when enough of them go on the fritz, your body starts feeling the pinch. That's why kidney disease is split into 5 stages: the more filters acting up, the more serious the stage. Imagine tying a string around your finger, cutting off the blood flow. If it's just a quick tie and release, no harm done. But if it stays on too long, the cells start dying, and your fingers toast. Now, if it's on for a shorter stint, you might get some swelling and discomfort, but no permanent damage. After a while, there might be some cell loss and scarring, but the finger could still function, albeit not as well as before. That's why predicting recovery is tricky. There's usually a window where we can gauge if the damage might be reversible, usually around 3 months. If your kidney function stays below par for those 3 months, that's when we start talking about chronic kidney disease, CKD. But even with CKD, all hope isn't lost. When blood flow's restricted in a kidney, not all filters are affected equally. Remember, you only need about half of them to keep the blood filtering job going. Some filters might be beyond repair, but others could bounce back. Since every case is a mix of mild and severe damage, some tubules recover while others don't. How that pans out for the patient depends on the balance between the two, and whether the disease keeps wreaking havoc year after year. So, to circle back to the burning question, can kidney damage be repaired? Now that we've got a clearer picture of how the kidney operates, it's evident that some damage can be fixed while some is permanent. This underscores the importance of starting treatment pronto for the best shot at recovery. And that sets the stage for tackling the next toughie: how can I boost my kidney function to dodge dialysis? But hold your horses. Before we jump into home remedies, there are steps you can take to slow down kidney decline, especially if you catch it early. Remember, the earlier, the better. Even if you catch it in the later innings, there's still hope for a decent quality of life with kidney disease. While there are various causes of CKD, certain lifestyle changes can help delay the need for dialysis or a kidney transplant. In the U.S., diabetes and high blood pressure top the charts as the main culprits behind CKD. Let's talk about how to take care of your kidneys if you have diabetes. First things first, it's crucial to keep your blood sugar levels in check. Your doctor may prescribe medications like ACE inhibitors or ARBs to help manage your blood pressure and protect your kidneys. It's super important to stick to your prescribed treatment plan and take your meds as directed. Research has found that certain blood pressure medications can actually safeguard your kidneys, even if your blood pressure is normal. Alongside that, keeping your hemoglobin A1C below 6.5% is key, and make sure to get your kidney function checked at least once a year. Managing diabetes and keeping an eye on your kidney health go hand in hand. So remember, controlling or even preventing these conditions can really help keep your kidneys ticking along nicely. Let's dive into the relationship between high blood pressure and kidney function. For patients with high blood pressure, it's crucial to aim for a blood pressure reading of 125/75 or lower if you have kidney issues but aren't diabetic, or 130/85 or lower if you have diabetes. While this is the general recommendation, it's important to remember that every patient is unique, so always follow your doctor's advice. Why the emphasis on blood pressure control? Well, if your diabetes and high blood pressure aren't kept in check, they can wreak havoc on your kidneys non-stop. Aside from blood pressure management, there are other steps you can take to safeguard your kidney health. These include adopting a healthy diet, ensuring you're getting all the necessary nutrients, shedding excess weight, and incorporating regular exercise into your routine. These lifestyle changes are crucial for maintaining overall health and can even help prevent type 2 diabetes in some cases. Additionally, individuals with high blood pressure should watch their sodium intake, and cutting back on protein and phosphorus in the diet might also slow down kidney disease progression. Now, researchers are looking into various foods and medications to see if they can delay kidney failure. Fish oil, for example, has shown promise, particularly for patients with IgA nephropathy. Antioxidant and anti-inflammatory vitamins and foods may also offer benefits for those with chronic kidney disease, CKD. As for baking soda, can it really lower creatinine levels? This question is often asked, yet a straightforward answer remains elusive. But don't worry, I'll shed some light on it today. Baking soda can help in many cases if you have kidney disease, but not everyone will benefit equally from it. There's a proper way to take it that you should be aware of. Several studies have shown that sodium bicarbonate can improve renal function in patients with metabolic acidosis. But what exactly is metabolic acidosis, and why is it important? It's not acid reflux or heartburn, it's a condition where the blood becomes more acidic. This is often linked to chronic kidney disease because the kidneys become less efficient at removing acid from the body when they're not functioning properly. When metabolic acidosis occurs, it disrupts the body's acid/alkaline balance, potentially accelerating CKD progression and leading to increased protein in the urine, indicating faster kidney damage. Symptoms of metabolic acidosis can include long and deep breaths, a rapid heartbeat, headaches or confusion, weakness, extreme fatigue, vomiting or nausea, loss of appetite, but not everyone will experience symptoms. The issue with metabolic acidosis is that if acidity levels in the body become too high, it can further damage the kidneys. Essentially, it's a condition caused by kidney disease that worsens kidney function. Understanding this makes it clear why treating this condition is crucial. Left untreated, it can also lead to bone loss, osteoporosis, endocrine disorders, and muscle loss. Being able to address all these issues with a home remedy like baking soda is remarkable. But how does it work? Baking soda, or sodium bicarbonate, is an alkaline substance that neutralizes excess acids, which are at the root of these problems. However, using baking soda as a supplement should never be done without consulting your doctor. Don't try anything just because you read it here. Baking soda can have side effects, such as nausea and bloating, and it contains sodium, which can increase blood pressure. So, it can be risky to take it unnecessarily. Also, not everyone will respond the same way to baking soda. While metabolic acidosis is common, not every kidney patient experiences it. So, what should you do? Should you take baking soda, or should you avoid it? There's a simple solution, the bicarbonate test, also known as the CO2 blood test. This test should be part of regular monitoring for kidney patients, but it's not always performed, so be sure to discuss it with your doctor and ensure you're being tested for CO2. Why am I telling you this? Because managing metabolic acidosis is one of the best ways to improve kidney health and lower creatinine levels. If people believe baking soda can help with kidney disease, it's because it can address metabolic acidosis. But there are other steps you can take to prevent this issue and start improving your kidney health. The very first thing you should do is get tested, again. Baking soda won't do any good if you don't have metabolic acidosis. So, to determine if you have this problem, you need to undergo the CO2 test. Typically, the CO2 test is included in the Basic Metabolic Panel, BMP. Perhaps you've already had it done? Now, let's talk about the normal range for CO2, which typically falls between 23 to 29 milliequivalent/L, milliequivalent units per liter of blood. If your CO2 level is below 22, It's time for immediate action. Now, if you find yourself in need of baking soda, how should you take it and what's the right dosage? Well, baking soda can be consumed orally or taken sublingually. Today's kidney experts recommend starting with small doses of sodium bicarbonate. Begin with just half to 1 teaspoon of baking soda each day, adjusting the amount based on your blood work. Many patients also opt for sodium bicarbonate tablets, usually 650 milligrams or 1 grain per tablet, readily available at pharmacies. If you prefer, you can also use regular baking soda from the supermarket. It's more affordable and easier to find. Though it may have a harsh taste, it gets the job done. To avoid bloating, take sodium bicarbonate between meals on an empty stomach. So, after discussing with your doctor and getting your CO2 levels checked, start with a small baking soda dose if recommended. Then, when it's time for your next CKD analysis, schedule another CO2 test to monitor progress and adjust your dosage accordingly. Now, can baking soda help you steer clear of dialysis? Well, it seems it can not only slow down chronic kidney failure but also lend a hand with heart disease, slow down the degeneration of the endocrine system, and assist with muscle and bone issues. But remember, only take sodium bicarbonate or any supplement if your healthcare provider advises it. And let's not forget, along with prescribed sodium bicarbonate, improving your renal diet is key. Do this. No kidney patient will ever lose a kidney again. Have you ever felt the fear and uncertainty that comes with kidney disease? You're not alone. But today, I'm going to share something that will change everything you thought you knew about this condition. Imagine a world where no kidney patient ever has to face the prospect of losing a kidney again. Sounds incredible, right? Well, it's not just a dream. Recent scientific breakthroughs have brought us to the brink of a revolution in kidney health. We're talking about a groundbreaking study involving over 400 participants, spanning an incredible 8 years, unveiling secrets that we never knew. And the most exciting part? I'm going to reveal how even those in the advanced stages of kidney disease, yes, stages 4 and 5, can reclaim their health. You're about to discover the 5 transformative steps that are empowering kidney patients to take control and rewrite their stories. So, are you ready to join this journey towards a brighter, healthier future? Let's embark on this life-changing path together, starting right now. Step 1. Mastering oxalates. Let's delve into the world of oxalates and their impact on kidney health. Picture oxalates as these tiny, natural compounds that are found in a variety of plant-based foods. While they're a part of many healthy diets, they can be a bit tricky for our kidneys. When we consume foods high in oxalates, like spinach, rhubarb, beets, and certain nuts and seeds, these oxalates can team up with calcium in the urine to form crystals. These are the building blocks of what many know as kidney stones. It's a bit like a party getting out of hand in your kidneys, and nobody wants that. But here's where the magic of balance and smart choices comes in. You see, not all oxalates need to end up causing trouble. Some foods, particularly those rich in calcium, play a crucial role here. A study published in the Journal of the American Society of Nephrology in 2014 found that dietary calcium binds with oxalates in the intestines. This partnership is important because it means oxalates are less likely to travel to the kidneys and form stones. Foods like low-fat yogurt, milk, and cheese are great allies in this journey. Then there's fiber, another superhero in our story. High-fiber foods, such as whole grains, fruits, and vegetables, have a knack for binding with oxalates in the gut. This binding action was highlighted in a 2013 study in the Clinical Journal of the American Society of Nephrology. By doing so, fiber helps prevent oxalates from being absorbed into the bloodstream, thereby reducing the risk of them reaching the kidneys and forming stones. So, what's the takeaway? While it's smart to be mindful of high oxalate foods, it's all about creating a balanced diet. Swapping out some high oxalate veggies for lower oxalate options like cauliflower, cucumbers, and peas can be a great start. And remember, boiling vegetables can also help reduce their oxalate content, a simple yet effective trick. And now, if you've been touched by the sincerity of our content, why not subscribe to our channel and spread the word to your friends and those bravely battling kidney conditions? Click on the bell icon to stay always updated. Moving on to step 2. Embracing fiber to fight uremic toxins. Gather round, because this is a real game changer for your kidneys. Ever heard of uremic toxins? These are the unwanted guests in our bloodstream, especially when our kidneys are playing catch-up and filtering them out. They're born from protein breakdown, amino acid metabolism, and other bodily processes. When your kidneys aren't in top shape, these toxins, like creatinine and urea, can start to pile up. Here's where the magic of fiber, particularly soluble fiber, comes into play. Imagine it as a friendly sponge in your gut, mixing with water to form this gentle, gel-like buddy. This gel is pretty good at one thing: grabbing onto waste products, including those sneaky uremic toxins, and stopping them from gatecrashing into your bloodstream. Let's talk about a superstar in the soluble fiber world, acacia fiber. This humble hero comes from the sap of the Acacia Senegal tree. It's like the MVP of soluble fibers, boasting about 85 to 95% of its weight in this kidney-loving nutrient. And here's something that might surprise you: some studies have shown that people with serious kidney issues have managed to keep dialysis at bay for up to 8 years with the help of acacia fiber. That's pretty incredible, right? So, by welcoming acacia fiber and other soluble fibers into your diet, you're essentially setting up a friendly barrier. This barrier keeps the bad stuff, like uremic toxins, from getting too cozy in your bloodstream, which is a big win if you're navigating kidney disease. Let's keep looking after our kidneys together, one step at a time. Moving on to step 3, it's all about increasing your vitamin D intake. Now, you might be thinking, how much difference can one vitamin make? Well, it turns out quite a lot. Research indicates that a significant 80% of individuals with kidney issues are in need of more vitamin D. This isn't just a random statistic. A lack of vitamin D has been closely associated with the onset of kidney disease, highlighting its crucial role. Here's the thing about vitamin D: it's a bit of a multitasker. It plays a pivotal role in regulating blood pressure, maintaining bone health, and can even contribute to lowering creatinine levels. And there's another condition called proteinuria, where too much protein ends up in the urine, often signaling kidney damage. Vitamin D steps in here too, shown to help prevent this condition, thereby offering an extra layer of protection for your kidneys. To check your vitamin D levels, there's a test known as the 25-hydroxy vitamin D test. If the results show less than 30 nanograms per milliliter, it's an indicator that your vitamin D levels could use a boost. The good news is, it's quite straightforward to increase your intake. Taking about 2,000 international units of vitamin D daily, along with some vitamin K2 and magnesium, can be beneficial. And for those with more serious kidney issues, there are specific types of vitamin D supplements that doctors can prescribe. Let's explore step 4. Identifying and addressing the root cause. When it comes to protecting your kidneys, it's crucial to tackle the underlying issues head-on. Here's a surprising fact: nearly half of the individuals with kidney problems also struggle with diabetes. Yes, diabetes is a leading cause of kidney disease. Many people with type 2 diabetes believe that if they've had the condition for over 6 years, there's no way to reverse it. However, recent studies have brought some good news. They reveal that even if you've been living with type 2 diabetes for as long as 11 years, there's still a chance to turn things around. Isn't that remarkable? So, what's a natural approach to combat diabetes? It starts with your diet. Recent research has shown that simply changing what you eat can put diabetes into reverse. A natural remedy that's gaining attention in the fight against type 2 diabetes is apple cider vinegar, ACV. Integrating ACV into your routine is simple. Just mix 1 to 2 tablespoons of unfiltered ACV in a glass of water and drink it before meals, 2 to 3 times a day. This concoction can help lower blood sugar levels and improve insulin sensitivity. But that's not all. ACV might also aid in weight loss. During a study, individuals who consumed about 15 milliliters of ACV with their lunch and dinner experienced almost double the weight loss compared to others. Since obesity is a major risk factor for diabetes and heart disease, incorporating 1 to 2 tablespoons of ACV daily can be a beneficial step towards preventing various health issues, including kidney disease. Let's move on to step 5. Making simple dietary adjustments. Alongside the advice I've shared in the first 4 steps, a few straightforward tweaks to your diet can significantly aid in your recovery from kidney disease. Firstly, it's important to cut down on sodium salts to manage blood pressure and fluid retention. This means steering clear of processed and packaged foods, notorious for their high sodium content. Depending on your kidney disease stage, you might also need to watch your protein intake. Consuming high amounts of protein can burden the kidneys, particularly if you're already dealing with kidney stones or chronic kidney disease. It's a good idea to consult a healthcare professional to determine a safe level of protein consumption for you. Potassium is generally beneficial for people with healthy kidneys and even those in the early stages of kidney disease. However, if you're in an advanced stage, your kidneys might struggle to regulate potassium levels. In such cases, limiting high potassium foods like bananas, oranges, tomatoes, and potatoes becomes essential. Refined carbs, such as white bread, white rice, and pasta, should be avoided. Instead, opt for complex carbohydrates like whole grains, fruits, and vegetables. Among these, certain fruits stand out for their kidney-friendly properties. These include apples, berries, grapes, pineapple, watermelon. These are usually high in fiber, help manage blood sugar levels, and provide energy without overworking your kidneys. Limiting alcohol consumption is also crucial, as excessive alcohol can impair kidney function and potentially interact with medications. For those with diabetes, controlling blood sugar levels is vital for kidney health. Work closely with your healthcare team to manage your diabetes effectively. Lastly, staying hydrated is key. Water aids your kidneys in eliminating waste and toxins efficiently. However, if you're already dealing with kidney issues, consult with your healthcare expert about the right amount of water intake for your condition. As we wrap up our journey through these 5 essential steps for kidney health, I want to leave you with a thought. How will you implement these steps in your life? Maybe you'll start by tweaking your diet or exploring the wonders of apple cider vinegar. Remember, every small change can make a big difference for your kidneys.